All right, let's just jump right in. We've all seen it, right? How fast something can spread. I mean, 1 minute it's a cough, the next it's everywhere. It feels totally chaotic, invisible, just completely random. But what if it's not? What if we could actually see the secret roads a virus takes as it travels through our world? It always starts so small, doesn't it? I mean, think about it. Just one single moment, one little interaction, a cough in a crowded room. It seems like nothing, really. Totally insignificant. And yet, somehow, that one tiny event explodes. It spirals out, connecting one person to the next, then one community to the next. And before you know it, it's this huge, complicated problem that affects, well, everyone. So how does that happen? That's exactly what we're going to break down today. Okay, so section 1, mapping the invisible chaos. You see, to actually get a handle on something this complex, public health experts can't just guess. They need a map. They need a way to bring some order, some visibility to what looks like just pure chaos. Yeah, the whole goal here is to take that big, messy tangle of chaos and basically put it under a microscope. We're looking for the hidden structure underneath it all. We need a tool that lets us see those invisible highways and backroads that a virus uses to get around. All right, section 2, the power of connections. And that tool, that really powerful map we're talking about, it's actually built on a surprisingly simple idea. It all comes down to one thing: understanding connections. This idea, it's pretty much the foundation of all modern epidemiology. It's called a graph network. And I know that sounds super technical and maybe a little intimidating, but trust me, the idea behind it is so simple. Just think of it as a fancy connect the dots picture that shows who's connected to who or what's connected to what. That's it. So every graph network, every one of these maps, starts with the dots. The technical term for them is nodes. But really, a node can be anything. It could be a person, a whole city, an airport, you name it. It's just a single point on our map. And then what do you do with dots? Well, you connect them. The lines that link these nodes together are called edges. And an edge is just the relationship, the interaction between two of those dots. Let's make this a bit more real. Okay, think about your favorite social network. You're a node. Your friend, they're another node. And that friendship between you two, that's the edge. It's the connection. Now let's apply that to disease. A node could be a person, and the edge could be something like a handshake. Or zooming out, a node could be an entire airport, and the edge is the flight path to another city. You see how that works? Super simple parts that build a really powerful map. All right, section 3 is called putting the map to work. So we've got our dots, our nodes, and we've got our lines, our edges. Now for the really cool part. Let's actually put this map to work and see how it helps us understand a real outbreak in action. So let's run a simulation. Here's our network of people. Now watch, one person, our first node, gets sick. And look at that. The infection just travels along those edges, spreading from one person to the next. But what's really fascinating here is how some of these nodes are lighting up like a Christmas tree way more than others. Those are the super spreaders. They're the highly connected people who are responsible for a massive number of new infections. Okay, now for scenario 2. We're running the exact same situation, but this time we use our graph network map to spot that key super spreader node right at the beginning. And by isolating just that one person, look at the difference. The outbreak is just stopped in its tracks. It's dramatically contained. And this is so powerful because it shows it's not about shutting everything down. It's about making smart, targeted, surgical interventions. And look, this is not just some cool computer game or a theory. These models are used every single day to do some pretty incredible stuff. We're talking about forecasting where an epidemic might pop up next, tracing contacts all the way back to find patient 0. And get this, they can test different vaccination strategies virtually on a computer before they ever roll them out in the real world. That saves time, it saves money, and most importantly, it saves lives. And these models can get way more sophisticated. We can zoom out, right? We can go from looking at people to looking at populations. This is called a meta-population model. In this case, an entire city, like City A, becomes a single node. And the highway or the flight path connecting it to City B, that's the edge. And this lets us predict not just how a virus moves through a single neighborhood, but how it's going to jump clear across the country. And of course, the tools just keep getting better. We have things like dynamic graphs now. These are maps that aren't just static pictures. They're alive. They change in real time as people move around. So imagine a map that updates itself after a big concert, showing you where the new risk pathways are. And then you have something called epidemic graph diagrams, or EGDs. These things are basically like a detective story for a virus, tracing the exact step-by-step path it probably took from one person to the next. It's incredible detail. So let's talk about the future in Section 4, Smarter Interventions, Safer Future. Where is all of this technology taking us? Well, it's leading us to a future where we can respond to health crises way faster, much smarter, and just a whole lot more effectively. This quote really just nails it. Graph networks make the invisible pathways of disease visible, allowing for precise, targeted public health interventions. That's the whole ballgame right there. It's about taking something we can't see, this invisible spread, and putting it on a map so we can understand it. And once you can see it, you can be precise. And the future of this stuff is just wow. So right now, we're already using real-time mobility data to see how people move around. But next up, we're going to be adding AI into the mix to find patterns that a human brain just could not see. Like an AI might notice that new cases are all popping up along the delivery route of a certain company, a connection that would be totally invisible to us. And the end game, the big goal, is to build systems that can automatically detect the tiny digital whispers of an outbreak before we even know it's a thing. I mean, just think about that for a second. What if we could get so good at this, so good at mapping these hidden connections, that we could stop an outbreak before most of us even knew it had begun, before it even becomes a threat? That is the promise of this technology, and that's exactly what researchers all over the world are pushing for. So there you have it. That's how we're learning to map the invisible. It all comes down to connections, from that single cough all the way up to a global network. I'd love to know what you thought of this explainer and what other complex topics should we try to map out next. Drop your ideas in the comments. And of course, if you want more explainers like this one, make sure you follow our channel. Oh, and if you prefer to just listen, you can find the audio version on Apple Podcasts. The link is in the description. Thanks so much for joining me.